Yeah, so within the United States, over the last year, there's very excitingly been two FDA approvals for patients that have severe sickle cell disease and then also transfusion-dependent beta thalassemia. The two major products are Bluebird Bio's Lovo-cel, and then the one I discussed today at the meeting is Vertex's exa-cel. Exa-cel is an autologous CRISPR-Cas9 gene editing cellular therapy in which there is an introduction of a mutation within the enhancer region of the BCLA11 gene. And what this does is it allows for increased hemoglobin F to form within the red cell and essentially mitigates and also prevent future sickling and thus vaso-occlusive crises in patients. So this year that was published in the New England Journal, and then what was also updated on at ASH were some of the longer term follow-ups for patients that were treated on the phase 2 CLIMB 121 and then the phase 3 long-term follow-up CLIMB 131 studies. And very impressively, they found that over 90% of the patients that were treated really had a substantial reduction in the number of severe vaso-occlusive episodes within a period of all the way up to 5 years after receiving the exa-cel therapy. Similar data was also reported in thalassemia. The field's also now moving forward with newer approaches, particularly a new type of gene editing called base editing. And what's advantageous about this is that there seems to be a reduction in some of the toxicities that we see that are associated with the busulfan preparative regimen that's given as a part of the treatment. And so Beam Therapeutics published and reported at ASH this year 11 patients that were treated with their base edited form of this compound to increase the amount of hemoglobin F in red cells. And again, very impressively, they found that most of these patients had excellent responses, but the median time to platelet and neutrophil engraftment was markedly reduced as compared to exa-cel. So I think these are just two examples in the red cell space that highlight how quickly and excitingly the field's moving forward with gene therapies. We're also now implementing this in other types of hematological malignancies, particularly my focus with cellular therapies and leukemia. And I think this is really going to yield more and more approvals moving forward in the future.